Coming to the last part of this story, that is the hand. And just below this pollice is a thumb. At the metacarpal, first metacarpal, you see a bulk that is tenar group of muscles, right? Opposite to this, along with the bulks present below this metacarpals of the fifth one is named as, this one is tenar, so this one is hypotenars. Then we have lumbricals. Lumbricals is always associated with the deep one profundus. So with the profundus tenders, they are attached, and palmas and dorsal controcees are present between these metacarpals. So these are the muscles. So we have here tenar group, hypotenar, lumbricals, then dorsal interosei and palmar interosei, 5 group of muscle, each containing 4. And there we have 20 muscles this way into the hand, right? By this way, if you trace the radial artery, similarly there, the ulnar artery, we can notice over here at the palmar arches as well. But that is not visible on the camera because for that dissection, we need to do 2 zooming. And it's like something coloring, and you see only a single color in this camera. So I'm not showing this. So that is about a quick revision of the upper limb gross anatomy. Thank you.